Hi, I'm Dr. Edwin Lee. I'm part of the AMMG committee. I have the privilege to interview Dr. Ken Sharlin. He's a neurologist, does functional medicine in Missouri, and he has a wonderful talk that he's going to be talking about reversing cognitive decline. And I'll just like to ask you, when did you get curious on functional medicine and cognitive decline? And just kind of give us a little story on your journey.
Yeah, my journey is really, of course, like many people, it's been a process, and it goes back to about 2006 when my wife, who is a gerontologist and runs a marketing program for a large hospital, came home and announced that she was starting a bicycle club. And I'd grown up riding my bike everywhere as my main mode of transportation, but hadn't ridden a bike for a few years, didn't own one, so we had to go out and get some bikes. And one thing led to another, and we got very interested in cycling, longer and longer distances. And eventually, we became triathletes. And in fact, I became an Ironman triathlete, which is a race that consists of 140.6 miles. And it's a swim, bike, run race. At any rate, in order to accomplish that kind of goal, I quickly became aware that it was more than having an exercise plan for the day. I had to be aware of the quality of my sleep, my nutrition, the stress on my body, and I even depended on my connections with my family, with my triathlon club, to accomplish those goals. And those are the fundamental lifestyle factors: sleep, movement, nutrition, stress, and relationships or connection. So my life was changing, my body was changing, I was accomplishing these incredible things on a personal level, but at the same time I was going to the office and I was taking care of patients and following the conventional model, which we sometimes call the pill for an ill. If you have a disease, you make a diagnosis, you have a disease, you get a drug, right? How long do you take the drug, doctor? Well, probably forever, right? That's not very rewarding for the doctor, and it's certainly not very rewarding for the patient, especially when my body and my health are changing due to these lifestyle factors. One day I had the opportunity to listen to a podcast, and just by coincidence, it was the neurologist, Dr. David Perlmutter, who was talking about his book, Grain Brain, and then he said, in fact, that he had just gotten back from teaching a course about functional medicine. I thought, functional medicine, what is that? I looked it up. You know, everything's on Google these days, so looked it up, and lo and behold, I discovered this whole new world of what I could do to potentially help my patients, change the trajectory of my medical practice, and change the trajectory of people's lives.
It must be really rewarding to see some of your patients to go from a place where they're failing conventional medicine to regain their brain. So do you have some interesting case study or a short,
Absolutely. So first, again, I'm a neurologist,
right.
So I take care of people of Alzheimer's disease, Parkinson's, MS, epilepsy, migraine. Let's take a step back, and I was talking a little earlier about a very important paper published by Dean Ornish, very famous preventative medicine physician. Dr. Ornish published a paper in which he basically implemented a diet and lifestyle and stress reduction program with social support, and he showed reversal of coronary artery disease. So people who might otherwise need heart bypass surgery no longer needed surgery. Now that was 1998, but in 2019, in general, I think you would agree that most people understand that things like exercise and nutrition have a tremendous impact on heart disease, on blood pressure, on the risk of what we call type 2 diabetes or insulin resistant. These are lifestyle diseases. But if I told you, for example, that the same principles could apply to Alzheimer's disease, you might say, come on, Dr. Sharlin, there's no cure for Alzheimer's. Well, I don't know that there's a cure yet for Alzheimer's, but let me put it this way. We now know that about 25% of the total contribution of factors to a given chronic neurological disease is genetic. But that also means that 75% of the contribution to that disease is environment and lifestyle. So in the very same way that we can change the trajectory of someone who has coronary artery disease, high blood pressure, diabetes, obesity, we can change the trajectory of neurological disease, including the cognitive decline of Alzheimer's. So here at the conference, I'm going to be presenting a fantastic case. The gentleman's name is Robert. He started out with a low score on a standard memory test we call the Montreal Cognitive Assessment Test. His score was 19 out of a possible 30, where 26 to 30 is normal. And within 6 months, he scored a 26 out of 30.
Wow.
Now, he has a documented Alzheimer's disease, what we call biomarker positive Alzheimer's disease. So we changed the trajectory of this gentleman's condition. Now, you could say, well, that's one case, and that's true. I'm very indebted to a neurologist by the name of Dr. Dale Bredesen, who really showed that these principles were very possible in Alzheimer's disease. I've worked with Dr. Bredesen, and last October, Dr. Bredesen and myself and some additional colleagues published a paper called Reversal of Cognitive Decline, 100 Patients. It is the largest single case series of reversal of cognitive decline ever published. And I'm very proud to say that of all the authors, and everyone was important and contributed, but my office and my staff and I contributed a full third of those patients.
That's
so
amazing.
We have been doing that in the greater Springfield, Missouri area.
Congratulations. That's awesome.
It's the beginning.
You're helping, yeah.
Yeah.
And I tell this to my patients, and I'm a big believer, is the body and brain can heal itself if it's given the right path or supplements and removing toxins. So,
absolutely.
I mean, all the principles we do in functional
and
medicine.
hormone balance,
Exactly.
Very important. Absolutely have to do it all.
So
yes.
It's amazing. You're an Ironman. I also did an Ironman too. That was my prior life too. But let's not talk about triathlons. So anyway, can you give some case studies with, let's say, MS, which is a little more difficult animal there?
Right. And I must say, Dr. Lee, it's very important. People who are watching this, listening to this, they will have similar questions. Of course, these are great questions. And we're still in that sort of disease-driven model. We make a diagnosis, that is a disease. Right. We have a treatment plan. Functional medicine is a little bit different, and we always use the analogy of the tree in functional medicine. So at the outer branches of the tree are all the different diseases. Alzheimer's that we just talked about, MS, Parkinson's disease, migraine, epilepsy, or in the area of endocrinology, maybe Hashimoto's thyroiditis, maybe Addison's or Cushing's disease, or the other hormone-related disease disorders. And each one of those diagnoses has a specific treatment. In my office, I have a program called Brain Tuneup. So what we've done in Brain Tuneup is we're moving from those distant branches down toward the trunk, where we recognize that all of these diseases are really driven by some basic fundamental processes: inflammation, oxidative stress. In the case of many chronic neurological diseases we associate with aging, we look at the biology of aging itself, sometimes called senescence. So then we go further down the trunk to say, well, what drives inflammation? What drives oxidative stress? What drives this pattern of premature aging? And all of those things are interrelated. Of course, they're not independent. They're not mutually exclusive. So what we're doing, we're really working at the bottom of the trunk, the roots and the soil, so that fundamentally if a person has MS or if a person has Alzheimer's disease, the overall strategy is exactly the same. The difference is that we're treating the person, not the disease. So we do incorporate lifestyle factors, understanding where you are with your diet and making corrections so that nutrients are put back into balance. We have the proper relationship to food. Or that you have a fitness or exercise program that's actually going to make your brain better. Or when we sort of pop the hood and we do all of these very fancy labs and we identify where are the imbalances for you, say, that might be different from me. That's actually what makes the treatment different. But the broad concept framework, the protocol, what I call brain tune-up, is exactly the same for each of those diagnoses, MS or Alzheimer's.
Well, you're doing amazing work, getting great results. You've even published a paper. I'm looking forward to hearing your talk tomorrow. And anyway, it's been an honor to interview you. Is there one last comment you want to say to the community?
Sure. Well, if anyone would like to find out more about what we're doing at Sharlin Health and Neurology Functional Medicine, we have a terrific educational website. It's www.functionalmedicine.doctor, and doctor spelled out, so it's DOCTOR, so functionalmedicine.doctor, and all the information is there. If they just want to learn more about how functional medicine applies to neurology, about what we're doing in Ozark, Missouri, or if they want to become a patient or send someone to me as a patient. So
very good.
Thank you so much.
Thank you very much.
Yeah.
All right.